And it looks like she's joined. There she is. Hi, Rachel.
Hi, Michael. How are you?
I'm good. Sorry about that. It took me a minute there to get things together. I wouldn't show me the little guy that says add somebody to the conversation, but it got it. It's there now. So we got you. Thank you so much for joining me. I really appreciate it.
Oh, gosh, I'm happy to be here. I kind of want to dispel some of the myths going around about this coronavirus and just talk about what we know and what we can do.
Right. And well, I've been following your posts on social media. We've been friends on social media for some time now. And I just saw it and I'm like, oh, well, not only is she commenting sort of rationally and trying to address some of these issues, but she actually is a nurse and she has some insight into this that might be valuable, I think, maybe to people, um, maybe not to the New Yorkers. I think maybe they get it what's going on because of the mass numbers. So it's a little bit bigger and a little bit more in people's face. But maybe some of the places like where I am at, where there's only a handful of cases and people don't really necessarily, the conversation is going around, well, do you know anybody that actually has coronavirus? Which is kind of a silly question, but it's an honest question. And so maybe you can help answer that a little bit. Tell us first a little bit about yourself, and where you come from, and how you end up, being punished to come talk to me today.
Sure. I've been a nurse for just about 15 years now. Most of that time was in the emergency room or the ICU. Currently, I work in the peri-op department, which has certainly seen its share of changes related to this virus. Um, Most of the time I have spent in the Midwest. Currently, however, for the last 4 years, I'm in Colorado in a medium-sized mountain town. The population here is about 100,000. My hospital has just about 250 beds. We currently have 18 positive coronavirus cases. 11 of those are in the ICU. Not all of them are intubated and mechanically ventilated, but they are sick. They're critically ill. Um, we have, let's see. The 11 that are in critical care are on airborne and droplet precautions, which is something else I want to talk about today because there's a lot of misinformation out there. We've got politicians and experts telling us so many different things, and then they go back and they change their mind, and we need to try and sort out that information.
Absolutely no, and I was hoping that you would be able to address some of that. I think definitely one of the things that has been coming up is the correlation between the virus and people who've actually died, and so I know that hopefully we can maybe. There have been claims by different people across the nation in different positions that they're not necessarily taking precautions to suggest that things other than COVID-19 are responsible for certain deaths, and that they're even changing documentation sometimes. There was one in particular was a male nurse. I don't remember where he was at, but the claim was is that he had left the hospital that night with X number of deceased patients with this listed as the cause, and then the next morning he came back and that had been changed to COVID-19. So maybe you can address some of that as in the rest of this that we're talking about too, if you've seen anything like that or heard about that.
I have actually heard about a couple of those cases. I've seen Italy come out and make a statement that their numbers, their inflated death numbers, might be due to the way that they record death. Right now, they're attributing anybody who is COVID positive, they're listing that on the death certificate as the reason for death, despite all the other comorbidities, pre-existing conditions that people have.
Okay.
And that just adds to the confusion
Right.
and the fear.
Yeah. So okay, so then yeah, go ahead and tell us what it is you're actually seeing when you're seeing these patients and what's going on there in and again, it's I think it's important to point out that you're not in a huge city, and so there's a lot to be said about this idea of the proximity and the closeness and the fact that there's so many people in a New York or Florida, some of these places that it seems to be hit so hard.
Yeah, for sure. Like I said, the city that I live in is about 100,000 people, and we're very isolated. We're on the western side of Colorado, so we get traffic through here on the highway, but we don't see the same number of visitors as, say, Denver or New York or San Diego. New York and San Diego are certainly they're reportedly getting hit really hard. I don't currently have any friends in New York. I've seen some video of nurses and doctors from New York. I've also seen some uh, that's questionable footage. Um, my friend in San Diego, she says that they can hardly keep up with intubations, and that's a high population city with a lot of germ sharing. I don't doubt that's probably true. That's not necessarily the case where I live, and it's not necessarily the case where most people are. A lot of the response that we're seeing is in relation to what these huge urban centers are dealing with. So we're locked down, and practicing the same things that they are, even though we don't have the same situation, and that certainly confuses us as well.
Well, and I think it's scary for a lot of people, and so I think that's what's great about this is we're able to put a little bit of a reasoned voice and a picture on it because it is happening in the smaller places in the lower population. It took up until just a week ago for where I'm at in Topeka, Kansas, to see the first recorded patients of it. It was 3, and then it was 10, and and it's continued to go up and up. But this is also in relation to the amount of tests now that have come in. I believe all of a sudden there's more testing for it. It, can you speak to at all the thought that this has been around here for months and that I've heard some people say December. I mean, that it's been around that long. I myself am just on the downside of about a 4 week weird something or other that I've had to basically isolate myself. It's gone through the whole family and everything, and it seems to be respiratory. And that was, you know, I guess it's 5 weeks now. So it's that's been a little while.
There are a lot of really virulent things going around this year. I've seen a lot of people complain of having the same symptoms as this coronavirus, this COVID-19,
Mm,
sometime through the winter. I myself went through a bout of it where I even had pneumonia, and I had the fevers and the thick mucus,
wow.
um, back before we were really talking about the coronavirus. So, you know, I would speculate that it probably has been circulating much longer than we've been knowingly dealing with it in the United States. There's also a particularly virulent influenza going around this year. So we've got people on ventilators for influenza, and we've got people on ventilators for the coronavirus. And I think that kind of comes into play, with this whole the ICUs are full to bursting. It's kind of, we've got two things in play here. It's not all coronavirus.
Yeah, yeah, I think that's absolutely true, and well, it's funny because I keep seeing people talking about it, and my response has been, "You don't have coronavirus. You just got normal old flu. You ain't special." And I think that's probably what it was for me as well because it didn't seem to be. It didn't. The symptoms weren't quite the same as what they really talk about being, the COVID-19.
Yeah, they do. Those symptoms do seem to vary quite a bit from
Yeah.
person to person. They certainly seem punctuated by the fevers and the pneumonia,
Mm,
especially in the people who are getting the sickest from it.
yeah.
The nice thing about that is that as the medical system breaks down right now, and emergency rooms and physicians aren't willing to treat and see patients right now, these are things that we can manage at home a little bit, which is really good. Right now, we've got this grand period of uncertainty. None of us really know what's going on. There's a lot of confusion. So the more self-reliant we can be, the better.
That's a good point. That's a very good point, and I think everybody's realizing that now. It's an interesting time that we're going through. It's I think that uh, this it chasing everybody into their homes and away from their jobs. Of course, it's bad. We're going to have the economic issues that will have to be dealt with, but when it comes down to it, I think we've all been able to stop for a minute and take a little break. It'd be nice if there wasn't this fear hanging over us with the COVID-19 and the virus and everything and the potential of whether you got it or whether you don't or whether you can or whether you won't. Uh, it seems to be bringing people closer together, and I see more right now families outside enjoying the sun and being together and taking advantages than I've ever seen in any normal period of time. And so I think there's that bonus that we'll have to look forward to. I hope it's enough to take us through the economic portion of it.
I do too. That is certainly the honestly, to me, that's the scariest part right now, is that we've got so many people that aren't going to work, and they don't have the income rolling in to continue buying groceries. They don't have the resources around them, especially people who were maybe they relied on the medical system to take care of them on a day-to-day basis. A lot of those things are breaking down. So we've got on the plus side, we've certainly got a lot of families and communities that are stepping up and making sure that their at-risk populations are taken care of. But we've got a lot more ahead of us as far as that goes. We're just at the beginning of feeling what the fallout's going to be from all these people not going to work.
Oh, and that's if we're even at the end of this thing, right? I mean, it seems like every day they come out and they say, "Oh, it's going to be a little longer. It's another couple of weeks. It's another month. It'll be July. It'll be August. It just never. It's never ending. It seems like guesswork all the time, which shockingly enough, it seems what the sort of um, a political medical industry, if you will, is good at doing.
Yeah, for sure, for sure. And part of the problem is that they come out with these experts that want to tell you one day that masks are totally ineffective and people don't need masks. Then they determine that everybody needs masks. There's so much misinformation and so much speculation, and a lot of it is done by the people that they want us to take as experts. So we kind of have to sift through it ourselves and figure out what's the most judicious approach when we're talking about our health, and how to make sense of all of it. And it's a big challenge right now.
Yeah, yeah. The whole thing is a it's a whole gigantic question mark, and I don't know that we'll know all the answers. One of the things that is really frustrating is watching the change in the numbers and everything every day because we don't. They're trying. This is the argument, and it's on both sides too. It's the rational side and the kind of insane side. They keep using the same. Well, let's compare it to previous flu seasons, or let's compare it to this, or let's compare it to that. But you're talking about sort of settled numbers versus this real time event where we don't really even know what the numbers are. And we've also created this mass hysteria and this panic that has sent everybody to the ER to go and get tested. And so now we have a larger uh, a data set input, I think, than we would normally during the flu season, where there's not a panic about it. People who are noticeably sick and ill and need to go go get tested and go get the cure for it. We're going to go into a break. We'll come back and we'll continue this conversation, and we'll take some calls and maybe answer some questions from some people if that's all right with you.
Sounds great.
Awesome, great. We'll be right back with Rachel Nielsen. She's a nurse and she's helping fight coronavirus in her backyard. Welcome back to the show. It is Toward Anarchy. Go to towardanarchy.com. Look for today's date. It's April 5th, I do believe, if I remember correctly. If it's not April 5th in your world, just click on the archive, 2020, April 2020. It'll be right there. You'll see Rachel Nielsen is my guest. She's a nurse and she's battling coronavirus in her community there. And she's come to talk just a little bit of common sense and try to put some truth and a little bit of perspective on the whole thing. And as always, you can follow along. This is our short segment, but we're going to definitely take some calls, and I guess we already have some ready waiting. So I guess we'll go straight to John. He's in California. He's on line one. John, how are you doing?
Good, Frank. Can you hear me okay?
That's Mike.
I'm
Michael
sorry, Mike.
Storm.
Mike Church. Yeah. Yeah. I get my Anarchy mixed up with other things.
Hey, it's all right, as long as you get your Anarchy in there. What's your question for Rachel?
Well, for Rachel, I was just wondering if she could help me out with something that's been bugging me for since about a month ago, when I've been trying to find out about the testing for the COVID-19 killer that we're all worried about. And I went to the CDC website, and don't presume I know something that I don't. So I got an engineering background, not a immunologist background or like that. So I'll read a short sentence here. You'll see the drift of what I'm saying. And this is on the CDC website. It says, CDC has developed a new laboratory test kit for use in testing patient specimens for severe acute respiratory syndrome, coronavirus 2, and then they put in parentheses, SARS, which is a severe acute respiratory syndrome so far, hyphen CoV-2. And that is another version of the coronavirus. And then they put a comma after that, and they say the virus that causes COVID-19. So am I to surmise that that the test kits that they've got now don't directly test for COVID-19? They test for the SARS.
Sort of a marker that might point to it. That's a good question. Do you know the answer to that?
I really don't know the answer to that. That'd be a really good question for maybe somebody who's working a little more on the lab side of things.
Yeah. So
there's a lot of
confusion
about that.
I didn't mean to put you on the spot or anything. I just
no.
I mean, it goes to the heart of all the test data. What's all this test data worth? If they're not testing.
Well, I think a lot of times when they're looking for stuff like this, and you may be able to speak to this generally, is that they're just looking for certain markers, especially early on in testing like this. We got to go into a break. We're going to take some more calls. The number is 800-313-9443. When we get back on Toward Anarchy, we're talking to Rachel Nielsen.
You're listening to the Republic Broadcasting Network, because you can handle the truth.
We are living in an artificially induced state of consciousness that resembles sleep. The poor and the underclass are growing. Racial justice and human rights are non-existent. We have been lulled into a trance. They have made us indifferent to ourselves, to others. We are focused only on our own gain. That is their primary method of survival. Keep us asleep, keep us selfish, keep us sedated.
You're listening to Toward Anarchy on the Republic Broadcasting Network. Here's your host, Michael Storm.
Back to the show. We're off into hour number 2. It is Toward Anarchy, and we are live right here on the Republic Broadcasting Network every Sunday, 1 to 3 p.m. Central Time. And if you go to towardanarchy.com, you can follow along, look in the archive if you have to. And we're looking for April 5th, and the links are up there and to everything that I'm talking about today. And you'll see my guest is Rachel Nielsen, and she's a nurse, and she's battling coronavirus, and she's helping us sort of battle some of the confusion and everything. We don't want to delve into any speculation about conspiracy about where it may have came from or anything like that. And we're generally we're happy to try to answer directly any question that we feel that we can, but we'll try not to speculate on anything like just something technical like that, or with the regard to the test, something technical that we don't necessarily know. It seems to me that that is the case, as I was saying before we went to the break, that a lot of times with these tests, they're looking for markers of things, and then they can do other tests and stuff like that. And that may be the case in what John was asking. But if you'd like to participate in the show, if you had a question, it's 800-313-9443. If you want to join in the conversation, and we'll let you ask Rachel a question. And we'll, like I said, we were talking during the break, Rachel and I, just chatting back and forth on the text real quick, and just trying to clarify that we don't want to. That's the whole point of doing this, is to try to clear up some of the speculation and the ideas. That it's not a real event. I think there's something real going on here. It's not. I've explained before. It's not important necessarily, and certainly not at this point, and certainly not for our purposes. Where it came from, how it got here, what we need to deal with are the facts on the ground. And Rachel can speak to this about what you're experiencing there when you actually are dealing with these people. And you said that they're in the hospital that you're at. There are 18 confirmed. Do you know how many have been tested?
All of those have been tested. So those are official positives from the CDC. The only caveat I would add to that is that the testing that they're doing, I've seen that they're reporting up to an 80% false positive rate.
Oh, wow.
That it's really hard to sort information out of that too. At this point, we're really just kind of treating symptoms of disease, which can mimic a lot of things. But as far as how these patients are presenting, maybe we could talk about that a little bit.
Absolutely.
What they look like. We've got people walking around in the community who have the coronavirus or the COVID-19, and they deal with it just fine. They're out, they're moving around. They're not noticing the severe respiratory syndromes that some of the more critical patients are. So what that looks like, these patients who are being mechanically ventilated, these people have really high fevers. They have this cytokine storm, which we like to talk about as like a hot syndrome, where their heart's beating really fast. They're breathing really fast. They can't perform gas exchange. So that's the whole thing about the lungs, right? Is we've got these little clusters of alveoli in there for gas exchange, and they've got these thick secretions that are preventing that gas exchange. They can have hypotension, which is low blood pressure. That's kind of an advanced thing. They need medication in the ICU through an IV to keep their blood pressure up so that they can perfuse their organs. I mean, it's real serious stuff. And it's real, no matter what you call it, the patients are certainly presenting with the complaints. One of the things that seems to be really common are those thick secretions that people can't clear out of their lungs. And as far as like managing at home, if you get turned away from the hospital or trying to keep it from getting to the point where you need to go to the hospital, I have some recommendations.
Awesome.
Guaifenesin, or Mucinex, the brand name Mucinex, the generic is guaifenesin. Sometimes people love to have those brand names, but I'll tell you, if you go to the hospital, you're not getting Mucinex, you're getting guaifenesin. So the guaifenesin, if you take that around the clock to thin secretions, it's going to help you expectorate those. Some of these products have dextromethorphan, like the Robitussin DM. As far as the dextromethorphan, that's a cough suppressant. So I'm not sure that that's really something you want to do if you're actually trying to expectorate these thick viscous secretions. If you've got the dry tickly cough and nothing down there, by all means take the cough suppressant. But if you are taking the guaifenesin to try and thin out those secretions, don't take the cough suppressant. The cough is your friend. It's going to help you get rid of that yucky stuff that's preventing gas exchange in your lungs. There's been a lot of speculation about ibuprofen. At one point, somebody said something. Some experts said maybe there was a link between ibuprofen and worsening the response in the body. That information is no longer being spread. I took ibuprofen and Tylenol throughout my thing. I don't know if I had coronavirus. I'm waiting for a titer test to tell me if I did or not. Let's see. There are a lot of people who advocate for elderberry syrup. I don't know a whole lot about that. They sell it over the counter. Your homeopathic people and your natural health people would certainly be able to direct you on the elderberry syrup. I have seen experts say that elderberry syrup is not going to hurt you as far as this virus. So good for that. As far as the treatment regimen that people are being sent home with, it's azithromycin or Z-Pak. That's the antibiotic. That's available online from like fish stores, which will absolutely tell you, do not take this. It's not safe for human consumption. That's their liability waiver right there. It's a big prepper drug. There are online pharmacies in Canada as well, where you can buy things without a prescription. So that's something nice to maybe have around, especially if you don't know if your doctor is going to be willing to see you. Another drug that for a while they talked about, that hydroxychloroquine or Plaquenil, and then the president said it, and then people took it, and then they died because they didn't take it properly, or maybe they took a derivative or something. That is something that people are using to treat the disease. I don't know a whole lot about that one, so I certainly don't want to speak to it too much. Big things are just staying healthy and hydrated, making sure that you've got a good diet and you're giving your machine everything that it needs to try and recover and be healthy. Hydration is huge, especially for thinning out those secretions. That works with that guaifenesin to help thin those secretions out so that you can expectorate them. I think, a big thing going into this period of uncertainty is going to be knowing how to find resources. You don't have to know everything. You just make sure that you have people who know the piece of the puzzle that you need. Like, make sure you've got healthcare friends, people who know how to find resources and treat things before they get so big and bad that you have to go to the emergency department. As far as my local emergency department, my emergency department is not full of respiratory failure patients. It's not full of influenza patients. Right now, it's full of alcoholics on the street and bring in. It's full of domestic violence, especially since we've got this isolation situation going on now. We're seeing an increase in domestic violence cases coming into the emergency department. And then it's just our typical bread and butter. During this season, we've got asthmatics coming in. We've got the typical spate of like gallbladders and bad bellies and heart attacks. We're not just seeing these patients. And in fact, we're seeing far fewer patients than we typically would be at this year, because there are no more elective surgeries and because the emergency department is sending people home if they are not critical. They don't want to see you right now, which means you've got to learn to manage things on your own right now.
That's a good thing. It's always a good thing for people to be managing things on their own, but that's good to hear, and that's good advice. How about albuterol? Is that good for breaking it up if you have the inhaler, the atomizer, and
Albuterol is a bronchodilator, and certainly part of the cytokine response from this disease is that it's making all these tissues swell up,
mm,
and then you've got the thick secretions that you can't pass. So on the one hand, yeah, the albuterol might help to open that up, but that's only if it's got enough space to get absorbed.
mm,
Um, Also, I've seen people talking about like nebulizing silver and stuff like that. I don't know
mhm.
anything about that. If it works, that's fantastic. I know silver reportedly has a lot of antibacterial and antifungal properties. I just don't know a lot about that.
Okay. Oh, fair enough. Let's take another call. Let's talk to Fred in Michigan. He's on 5. Fred, are you there?
Yeah, I am.
Hey,
I'm here.
Fred. What's your question for Rachel?
Well, elderberry, a woman virologist some 30 years ago, when I first heard about this from a medical doctor being interviewed on the radio, uh, quite extensive research. Elderberry eradicates viruses big time. Um, and she may have been from the UK, I forgot, but it is a well-established fact. Elderberry is entirely safe at any dose. Um, and then there's a Dr. David Brownstein. I'm in Michigan. He's from Birmingham, Michigan. And Chris Hinckley on this network aired a broadcast from Adele Bigtree, the high wire with Del Bigtree. That's D as David, E-L, Bigtree, like it sounds, who had interviewed David Brownstein several times regarding this particular, as Ron Paul says, Corona COVID scam. And that's from the 16th of March, the RonPaulInstitute.org. And of course, Ron Paul has been an MD all of his life. Anyway, Brownstein cited a 150-year solution called Lugol, L-U-G-O-L. And Lugol's, L-U-G-O-L, solution is well documented to be an extraordinarily beneficial compound in optimizing thyroid function, especially a absolute remedy or solution for hypothyroid. And the interesting concomitant.
This is one of these things that we could probably go on all day about, the various potential cures and things like that, for sure. I appreciate you letting us know about the elderberry thing. I've heard good things about elderberry too as well, but it's like with any of this stuff, guys. You just gotta be careful. You gotta know yourself, and you have to know your own health, and you have to know the things that you're going to take. And they were talking about, we mentioned the thing earlier about the president had mentioned some particular drug, and what had happened is they took some other drug that is very similarly named. So I mean, what we really need here is some level heads and some just a little bit of attention to detail and things like that it'll be much better for all of us on the backside of this if we just take this one step at a time and think about it as we go along. We appreciate the call, Fred. Let's go to Ralph in California. He's on line 3. Ralph, you there?
Hi, how you guys doing?
Good,
Yeah,
Ralph.
can
How are
hear
you,
me?
man? Yeah, we got you.
I'm fine. Yeah, I'll just tell you my story. I just came back from the hospital because I'm a liver transplant patient.
Oh boy.
And I caused my own issue where I lowered my dose to stop the suppression of my immune system. Because when this started, that's what I was concerned about.
Mm-hmm.
So I had to go in there to get things controlled. Well, when I was there was like hardly anybody there. And I asked the nurse. They said they had 14 cases confirmed. And they tested me. I was clear. And then they told me later on that day, one of the nurses that attended to my needs was tested positive. So now I got to get retested.
Oh, no.
Yeah, so I'm fine. I think this is more overbloated than anything. Is it there? Yeah, I'm not saying it's not. But more people died of the flu last year, 80,000. That's 6,000 a month. But I think there's more forces behind the scenes going on. But just let you from my story, and then there was a tent, the triage tent.
Right.
I got there at like 9:30 at night on Wednesday. I got released yesterday. And there's nothing there. It was dark. And they want me to go there tomorrow and get that, get tested and find out in 2 days, which is another question. If this thing is that serious, why does it take 2 days?
I guess it just takes what it takes,
result.
Unfortunately.
Yeah, but just let you know that was my story.
Well, hopefully you'll be all right. Hopefully hopefully when the test comes back, you'll be fine. Appreciate the call, Ralph. There, what is that like for you, Rachel? What are you guys having to do as far as extra precaution? Is it really noticeable the extra work that you're having to go through anytime you guys come in contact with one of them or anybody who's suspected? Is it like have you ever seen Monsters Inc., where the sock is stuck to the guy's back when he comes back from visiting the child's room, and they break out and they attack him, and they take all of his fur off and everything because he's contaminated? Is it like that?
It is very similar. Yeah, it really kind of is. From right now, from the time a person arrives to the hospital, all of the patients and visitors are shunted through the emergency department right now. So they walk in the doors, they immediately approach a table that's staffed by 2 to 3 hospital staff members. They're all wearing isolation gear and masks, and they immediately zip the patient's temperature. If you have a fever and other symptoms, they stick you in a mask and they take you to a special isolation room where they finish your triage. Some of that comes back to, we still don't know. They're calling it droplet versus airborne precautions. The droplet precautions means that if somebody coughs or sneezes within 3 to 6 feet, those heavy droplets are falling on the ground rather than circulating through the air. But if it's actually airborne, then it's kind of like aerolized, and they're light little things that spray out, and people breathe them in and get them in their mucous membranes, and that's how they become infected. And we're still getting 2 different stories as to which isolation these patients require. I will tell you that while they're saying that it is droplet and that you're safe,
As always, we kind of come to the end of the conversation, but Rachel, I just like to give you a chance to fill in anything that you think you might have left out or that we hadn't discussed yet, that you thought that maybe we needed to cover. I thought it was a good point that you were bringing up just before we went to the break, because that had been a big question on a lot of people's minds. So if there was any more on that, otherwise, like I said, just anything that you think we didn't necessarily hit on that you thought needed to be addressed.
Yeah, you got it. A little bit more about that isolation or the precautions. We don't really, I don't know that we have a clear answer right now as to which is more appropriate. So erring on the side of caution perhaps is better. Most people who contract this disease are not going to be those critical patients. Most of us are probably gonna pass it without a whole lot of problem. But some of the more at-risk people are going to be people with heart disease, lung disease, obesity. I'm a smoker, so that puts me at an extra risk. people with autoimmune diseases, the gentleman who called in from California with his liver transplant. I mean, a lot of these are really fragile populations that have more to worry about by far. Those are the people that I would definitely suggest staying isolated away from other people who might infect them, that kind of thing. Something else that I wanted to mention was that some of the weird information that I get is from like regulatory agencies and things like that. So that's kind of like special nursing insider things that maybe the public doesn't find out about right away. Just yesterday, I got an email from the Department of Regulatory the regulatory agency DORA, saying that Schedule 2 drugs are prescribers are only going to be allowed to prescribe 72 hours of Schedule 2 drugs. When you look at the list of Schedule 2 drugs, for the most part, that looks like a lot of pain medication, opioids, and stuff like that. But it also includes Adderall. So, if you've got somebody in your family who's being medicated for ADHD and they're taking like the Adderall or something like that, that might affect you. So that's something to consider. As far as let's see. As far as the rest of ordering medications online, there are some threads out there for where people have ordered from like Canadian pharmacies if they're ordering medications that they require on a daily basis that they're not sure that the government is still going to be able to get to them, especially right now with pharmacological companies focusing on treatment and also maybe vaccines. They're not making your drugs like they were, so you need to secure alternative sources, especially if these are medications that you need to live. Diabetics for their insulin, consider finding another source besides just the pharmacy that you're accustomed to going to. What are you going to do if that's not available?
Oh, this is something that people in those positions, they probably don't necessarily think about a lot because the medical community just sort of hands you it and says, here, go over here, pick this up, and you can get that every month.
Well,
You
that's
just
how
call the
they like
number
it too,
until,
because that's
right.
that's control. They control the flow of those medications. But if
Mm,
if that trickles off, what are you going to
right.
do? How
What
are
are you
you
going to
going to
do?
find more?
Yeah, you need to be thinking about this all the time. Need to have these things in place. Have that second source. It reminds me of the episode of Married with Children when they discontinue Peggy's bra. She doesn't know where to find a bra anymore, so they had to go on a hunt for it. You got to be prepared for these emergencies, and I imagine that there are women that will have that as an emergency if these things continue. Thank you so much for taking out the time to help us clear some of this up. I really appreciate your perspective on it all, and I appreciate what you're doing out there on the front lines and actually helping to fight the thing. And appreciate your service.
Hey, you're welcome. You're welcome. It's my pleasure.
Well, thank you so much, and we'll do it again sometime in the future. Maybe we'll have a chance to talk about something maybe more interesting than the virus and all this stuff. I mean, we'll talk about you and some of the other things that you do because that would have been interesting to get into. But another conversation for another day for one of my anarchist friends.
That sounds great.
Awesome, Rachel. Thank you so much. Take care. That
You
was
too.
Rachel Nielsen. Just stick around. We're going to go into a break here, and we'll be coming right back.